Hi everyone, this is Nasheme here again. Today we're going to be talking about the Nclex. Yay! Did you just recently graduate? Are you looking to write your board exam, the Nclex exam? Are you concerned and you have a lot of questions in your mind? Never worry. I have few steps, few things, few tips for you to think about as you plan and study to write the Nclex. When I graduated from nursing school, I was confused because I didn't know what materials to use to study for my exams. I know many people might fall in my category. It might be my shoe at one point or the other. And that is why I've put this video together to help you walk through the process, to help you think about it in the right way. So, you are trying to write the Nclex. One of the things I want you to do is to ask yourself some questions. Ask yourself, and even if you don't want to ask yourself, actually ask people who have gone ahead of you, or people who are actually nurses, who are nurses on the floor right now, or people who have just done the Nclex. Ask them this question: what Q bank did you use for to practice? How did you study for your Nclex? Did you use any question banks? And there are different question banks. I've heard of there's Kaplan. I've heard of other ones, but I know you would, and I know Kaplan. Many people have talked about Kaplan and you would. So ask people, which one did you use? Which one worked for you? Which one didn't work for you as such? Ask those questions. Those are very important questions that you should ask, especially because you are new to the process and you want to do it the right time. You want to do it right. So ask those people those questions. The other question you want to ask them is, what strategy worked for you? Are there any mistakes I should avoid? What strategies doesn't work? One good thing I always think about when I think about this strategy thing, I always think you should know yourself. When you know yourself, you will know what works for you. Do you think you are an auditory person? Someone who just likes to listen to something, maybe a lecture or something being discussed in a group? Are you that kind of person? Are you just somebody who likes to read? You just like to bury your nose in your book and read, and you think once you read, you're good to go. Even if you don't listen to anybody talking about it, even if you don't listen to this, listen to that. Are you that kind of person that is a visual person, that needs to see the picture? You know who needs to see the picture. I'm telling you, was a very good choice for you. And you can ask other people. Because you can ask them to tell you what they think about, how Kaplan works, how UWOD works, and then you sit and decide based on your research, based on your findings. So if you're this person who likes to bury their heads in the book, use auditory method, see the visuals, and put all the dots together, and you also like to use your pen to write down stuff as you study, or draw stuff as you see the pictures. Whichever method you think work for you, you need to bring these methods together as you plan to study for the Nclex. It is very important. Some of us are just so good with this visual that sometimes even when we get to the exam, we forget this other part. All the words that we read, all the pages of books that we try to cram, but we may never forget the picture. And when we remember the picture during the exam, it takes us to the words. And that's the way I've seen it worked for me over the years, even when I was in nursing school. And I've seen that it has worked for many people. So these are the kind of questions I want you to ask yourself. So when you're studying for the Nclex, another thing, number 3, the third thing I want to talk about is that you need to pick like a study plan. Pick a study plan and stick to it. There are different study plans out there, and when I just graduated, I didn't know this. And the one day I just Googled it and I just said, oh, study plan for Nclex. And I realized there are a lot of study plans out there. So you just pick one that works for you. Pick a study plan, look at it, how it is structured and how it is patterned, because you want your studying for this exam is a big exam. The Nclex is a huge exam. It makes a difference between whether you will practice or not. You just came out of school, you really want to practice. And you really want to be able to pass your Nclex when you sit for it. So when you want to do, I have heard many people say, okay, use a structured environment. You can use a library, sit by the table, so that you know that you're focused and you are able to concentrate on what you're doing, and you don't have any distraction, because when you even go for the exam, on the exam day, you're not going to have drinks, you're not going to have no bottle, you're not going to have anything going with you. It's just you. So you want to plan to have both the study plan and the structured environment that will help you, that will enhance your study. The other thing I want to talk about, which is the fourth thing, number 4, schedule your time. Schedule your time. That is very important. Once you're getting out of school, you pick your Nclex day, that is fine. Now, you have a date set ahead. You have a time that you are looking at. Okay, I'm going to write my exam in the next, many people always say like in the next 4 weeks. Many people take their Nclex 4 weeks after graduation. And some people take their Nclex maybe 6 weeks, maybe a month or 2 months, depending on what works for them. Mind you, I need to warn you at this point. Don't copy anybody. Don't run the race of anybody. Mind you, you are running your own race, and it is not a competition. Everybody is in their own lane. Don't look at another person who says, well, I just came out of school, I can write it in 4 weeks. It may work for them. What if it doesn't work for you? I remember that I almost fell into that category. And I was always thinking, well, I'm going to rush, I'm going to do that. And then I had to sit myself down. That meant I am not running a race against anybody. I'm running my own race. I'm running my own race, and I need to stay in my lane. I need to focus. I need to know if I can really study and do it in 4 weeks. If I study and I do it in 4 weeks, that is fine. But if I don't have to, why rush? If I rush and go there and I fail, then I will be the one to suffer the pain, to go through the stress of having to study again. If I want to do it, why not sit down and do it right the first time? The time you sit for it, you do it right, you're not looking at anybody, and you are focused that I'm going to write this exam in 6 weeks, I'm going to write this exam in 1 month. You don't want to wait you don't want to go too early, and you don't want to go way after, like maybe months after you've graduated. You don't want to do that. But I always encourage people that they take it as soon as they feel they are ready. So the time structure is very important. The setting, the structure within which you do it is very important. And many people say, I remember that when we did our review, like 3-day review that you always do after nursing school, some people say, okay, when you want to take the test, maybe you can say, okay, I will do 6 hours a day, 7 hours a day. Some people even go as far as, okay, I'll do 7 hours a day, and I'll do like 75 questions per day. Here's what I think about that. If you do 75 questions per day, that is really good. you are going to be on the fast track. But my problem with that is you can do 75 questions per day and not have time to go back to review everything meticulously. Then I will ask you, why are you doing 75 questions when you are not able to go back to it? 75 questions is not a lot. And in fact, it's very good. It's a very good pace. It's like, it's like you're training your body. But I don't want you to fall into the trap of having to run the race of I have to do 75 questions every day. I have to do 75 questions every day. And at the end of the day, you do the 75 questions. You are not able to go back and review everything, write out the things that you do not understand. Then it will be a wasted effort. I always tell people, if you're using the U word, by the way, I recommend U word to people, but it still depends on what your preference is based on your findings. I've heard many people say U word is the best, and I'll tell you to go for it if you want. But my thing is, even if you're going for 75 questions, make sure that you go through each of those questions, both the right ones and the wrong ones, and make sure you're writing things that you don't understand down, because that is how you are able to be able to go back to the information, read through, and then you'll be able to retain it. Because there's no point doing so much questions and not being able to remediate. Remember, you really do not learn from the bulk of questions you do. You basically learn from the remediation. So I will encourage you. I always tell people again that the tutor mode of U word is your friend. Never joke with it. The tutor mode in U word is your friend. I'll say that for the last time. Tutor mode in U word is your friend. Never joke with it. When you go into U word and you pick like 75 questions at a time, you can just go and it will be timed. But there's this part too that you can just click on something that says tutor mode, and you can have it on time if you want. This tutor mode is like you take a question. You take a question. When you take that question, as soon as you hit submit, the submit button, it submits and tells you the rationale immediately. It tells you why you got it, why you got it, or why you didn't get it. It tells you what you need to do, how you need to think about every option. And you can never go wrong with the tutor mode. You can do as many as possible, even if you want to do 30 questions. I used to do, when I just started, I was doing 75 questions, and then I will review, and I will see that it will take forever for me to review because I want to get everything. And I realized that I wasn't really getting much. But when I started the tutor mode, it just changed the whole story. It was a whole different thing. I was able to learn better. I am going to conclude with this aspect of the choice of banks. While at the beginning I said ask people, those who have taken the exam, those who are nurses on the floor, just ask them, which of the Q banks do you use? Which of the Q banks do you prefer? Kaplan? In my school, we use Kaplan in my school. But when I graduated, I couldn't use it anymore. I just couldn't flow well with it. And then I had this word going around about U word. I was like, well, I'm gonna check it out, and I did. Believe me, I don't regret it. And I believe you won't regret it if you do too. You won't, because it will teach you all the content that you need to have is in U word. I use U word and some other materials my friend sent me. I also, at some point, I saw that I wasn't really doing well with my some of the things, the tests I was taking, because the U word has you have different subscriptions, and I bought the one that has this assessment, the 2 assessment, and I tried to do the first assessment. I took the first assessment and then I took the second assessment later, and I really didn't do well on those assessments. And I felt really bad about it. But at the end of the day, I started doing my research, and someone said, you know what? UWorld is not meant to assess you. It is meant to teach you. So my advice is, when you're doing the assessment and you're feeling bad, feeling this, feeling that, feeling defeated, come off it. Come off it. I've had people who said that they've gone to do the exam even when their assessment, even when they scored really low. I'm talking about low in the 40s. And that was what I had too. But trust me, I felt defeated. I felt pain until I kept doing research, and people kept saying, oh, that's what they experienced too at the beginning, and later it got better. Some of them went to take their tests and all that. Some people couldn't take their tests. They were afraid. They moved their tests. Do what you're comfortable with. That's what I'm going to tell you. Don't say because someone said, oh, they got 42 on the assessment, they went to take their test, they passed it, and then you want to do it. I don't want you to regret that action. What I realized was, when I saw that I was really scoring low on those on the assessment, what I did, I felt like, should I go back to content, or what should I do at this point? And at the end of the day, I didn't have a choice than to go back to the content. So one of the content that I use there's something called Pmonic. It's like it uses pictures to like explain the concept, and they do it so beautifully that you really don't have to like put so much jargon in your brain. Like you can just think about the pictures and the scenarios they present, and you will get the concept they are trying to present. I used that for just a little bit, and it really helped me. And then my friend sent me some material. I want to say that, and I'm so happy and I'm so glad that I used the method that the tips that people gave me, the strategies that people shared with me. I remember one of my friends said that, oh, you want to take your test, when you start practicing, make sure when you practice don't say you do 500 questions and then you go take your exam. Yes, that's worked for some people like that. They did 500, 600 questions and they went to take their test and they passed. Don't compare yourself to anybody. My friend told me, oh well, that was what she did, was she went through the whole bank and she was really scoring low. But after going through the whole bank, she went over it again. By the way, when she was doing the first round, she wrote stuff down. She learned the concept. And I've heard people say, I just take the test. I pick a bunch of questions. I do them. I get my result. But as I take them, I try to remediate. I go back to the ones I got and the ones I missed. I write them down. I ignore the score, because I don't want to get bogged down by the score. I just want to learn from it, because it's actually a bank that will teach you. So many of my friends said, many of the people I spoke with did that, and it worked. So the one that told me, go over the bank, do all the question bank, and then go over it again. She said that was what she did. And the second time when she was going over it, she was in the 80s, in the 90s. She was like, oh yeah, I think at this point I can go and take my exam. And that was what she did. That tip she gave me actually worked for me as well. I was really using one of the material, and I was using the UWorld. And when I finished the question bank, and then I started going over it again. What I actually did was I went over the ones that I missed. I missed like a lot. So I went over the ones that I missed, one after the other. And I saw that my grade really improved. It got better. I was very happy. And I say all of this just to let you know that you can make it. You can pass the Nclex. I studied day and night. I can tell you it was not easy. I'm gonna show you, like I can show you maybe later in some of my videos, or in this video later, I can show you what I did, like how I practiced. I had like this little stickers. I wrote stuff on them, put them on the wall. I did all that. And sometimes I put all these things together. I make up a audio and I listen to them. These things help me. At the end of the day, I sat for my Nclex. I passed with 75 questions. I couldn't have done it without the help of other people. One other thing that I didn't mention that I would like to talk about and conclude with is that look for an online forum, maybe on Facebook, where they have groups of people who are taking the Nclex, and join a forum. Maybe later in all the videos, after some of my videos, I can post like a link where you can come in, join the Nclex group, and you have Nclex buddies that you talk to, or you have this question, you think about it together, you have this question, you ask and people respond, and that is it. That's how it works. I just want to encourage you. You can do this. There's nothing you can set your mind on that you cannot do. Remember, always remember that. You can. When you believe you can, never give up. And even if you fail, don't you dare give up, because you are capable. Do you know why I know you're capable? You went through the nursing program. You graduated from the nursing program. And there you are, trying to write the Nclex. There is nothing that can stand in your way. Thank you very much for listening to me today. Thank you. I'll have other videos up. I'm gonna put up a video where I'm gonna be talking about strategies to use even in UWorld and Nclex. Watch out for that video. Please don't forget to comment below. Don't forget to like this channel and subscribe to this channel. Until we meet again. See you. Bye.